Assalamu alaikum everyone. You are watching Between the Lines with me, Tuba Tawfiq, on Kashmir Observer. Today's topic of discussion is going to be what seems like an exponentially escalating mental health crisis in Kashmir. In fact, the bridges of Sher-e-Khas, which were once representative of our identity, have now become emblematic of this mammoth crisis that is in front of us. In a study conducted by JLNM, of all the participants, 94% were seen to have severe anxiety, 42% had moderate depression, and 48% had severe stress. What this points out that at the heart of this crisis are mental health issues. So let's take back a step in reverse to get to the bottom of the issue, which are mental health illnesses. To understand this, we got in touch with revered psychiatrist and professor, Institute of Mental Health and Neurosciences, Dr. Arshaid Hussain. Thank you so much, Dr. Arshaid, for joining us. And this is a very, very timely debate. And I don't think that we have to stop talking about this anytime soon. So it's been said by even WHO that mental health issues could actually be a pandemic within a pandemic. Do you think so?
Thank you, Tuba, for inviting me for this debate. You're right. In fact, within first 3-4 months of the pandemic, there were lots of research papers, and in fact, WHO also said that we probably are going through a dual epidemic. One that there's a pandemic, COVID pandemic running, and then parallel with that, we have the mental health epidemic also going on. That's what was said. No, I in fact say that there's the triple epidemic going on. One, that we have a COVID pandemic. Second, that we have mental health issues cropping up. And third, that we have huge economic deprivation going on. Why did I bring that on? Is because all these three fuel each other. They fuel each other in a way which is very vicious.
So what you're essentially saying that sociological factors have a lot to do with your psychological well-being. So could you please tell us how much of a correlation do they have? Can a psychological illness happen irrespective of your sociological or your socioeconomic conditions?
What's grossly understood about all non-communicable diseases is there's a interplay of various factors in bringing about any non-communicable disease. Because it's very easy to understand physical non-communicable diseases. So I'll actually exemplify with them. So if you think of diabetes, for example, somebody is predisposed to develop diabetes, but he maintains a very healthy lifestyle. He exercises very regularly. He does all the right things, and it's possible that he might escape the genetic predisposition. While persons who might not be genetically predisposed, if they actually do not have a very, very healthy lifestyle and stay like that for a long duration of time, they have chances of developing diabetes. Now, both things are, this is like an egg and a hen story, which came first. But, the interplay is such intricate that it's quite possible that people who have genetic predisposition have genetic vulnerabilities, and then the other factors also come in. They have more chances of actually developing a mental illness than people who have genetic predisposition, but then there is not the interplay of other factors. If I think of mental illness, let's think of, for example, something which I talk to, I actually, there are two factors which are well understood in psychiatry, which have etiological rules. When I say etiological, means causative rules. One is traumatic violence. When there is huge traumatic violence, then you know that the people who might not be otherwise predisposed to develop a psychiatric illness might actually do that, what we commonly know as post-traumatic stress disorder. It might not have happened in absence of a traumatic violence or a traumatic event. Same is true about drug abuse. For example, there's a well-known research now that people who abuse cannabis during their adolescent years, they have high risk of developing schizophrenia than those who do not. So now,
Basically, we'll get
yeah,
back to the part about substance abuse in.
same weightage is to other factors. For example, people who are unemployed have 3 times more chances of having a depressive episode than people who are employed. There's a well-documented WHO research. You might be knowing that there was this very well known that depressive illnesses are more common in females than males. Now, worldwide, the view held was that this is purely a biological phenomenon because females are predisposed because of their hormonal malus. Females, while males attain puberty, they almost remain same till they actually die. But females keep on changing. They keep on changing in the month. They keep on changing in the day itself. And that hormonal changes probably predispose them to illnesses like depression. That's a well-known name. But there was a landmark WHO study which was done. And it found out that if you take away inequality, poverty, and domestic violence from females' life, then the chances of her developing depression vis-a-vis males becomes very close. There still is some biological predisposition. I would say that the ratios usually are 1:2. For every 2 females, 1 male gets depressed, to put it in a lighter note. But if you actually take away inequality, poverty, and domestic violence from females' life, the ratios come as close to 1:1.2. So that's how social factors and psychological factors interplay with each other to get an illness. So, just to make the viewers understand this phenomenon.
So let's first talk about the COVID pandemic. We all know that this is a very extraordinary external situation that suddenly dawned upon the entire mankind. And it has sort of exasperated, of course, we're all in agreement to the fact that it has exasperated mental health issues. In what ways has it done that, and what kind of mental health issues have risen in these times? Is it depression? Is it anxiety? Is it OCD? What exactly, and what could be the reason for that?
See, we'll go through what pandemic has done, that it has structured our mental health. So we will go through that whole stretch from normality to abnormal. So let's start with the normality. So what is in the normality is fear. Because of pandemic, because of the vulnerabilities which it created the people, it created fear. And it had to create fear because fear is a very normal phenomenon, is a very normal emotion in people. If it does not create fear, then the chances of us actually fighting the pandemic and limiting mortality and morbidity will be very, very low. The fear drives us to the precautious behaviors, and that's how we actually fight pandemic. And it has been the human history always, whether pandemics, whether ice age, whether all the disasters and whatever human race has faced throughout the history. If you look at that, the one factor with which they have fought it, that imbibing the fear and using that fear in the right ways to actually fight those vagaries of nature or otherwise. So whether this was fear of animals when they were in jungle, so they locked themselves in caves. They invented fire and so on and so forth. They in pandemics, if you look at various pandemics, they just locked themselves in rooms, did not move out for long durations of time. Very well-known phenomena. We are not doing very, very different things at this point of time. These are very well-known historical measures which we are currently doing. In fact, with much more luxurious things which are available to us that time, just for the survival, because pandemics usually are the periods of survival for human beings. And for that survival, what happens, that what's very important, that is to have the fear. And the fear actually then drives that survival instinct, and you do all the right things to actually survive that period. And it's absolutely normal to be fearful. And then to understand that being fearful is normal because the situation per se demands that. So accepting that fear, being fearful, number one thing, then accepting that fear. And what does that make us to do? That makes us to not being extravagant. That makes us to be live within that survival, do all things which are necessary, but not to do the extravagant things. So that is normality. Then in some people, it might be a little bit more. That's also fine. But in other people, it just cripples them. They're not able to function. And that's why the problems start arising. In the first pandemic, I'll tell, because, we are, this talk is particularly for our own culture, Kashmir. So, I'll talk in the context of that. In the first wave, last year, you live in the same culture, I live in the same. There was almost an absence of fear in whole culture, rather than the presence of it. It was very, very, it was a fringe element which actually understood the pandemic, had that understanding, and did the precautions. Generally, there was absence of fear. Now, inversely, what that meant, that probably there were not many mental health issues also coming to the fore, and that was true as well. Rightly or wrongly, I'm actually not saying that there should not have been. I think that there should have been, but there was not. Because ultimately what becomes the determinant of mental health problems, as it said last year as well and continuously say, is mortality and morbidity. In our cultures, unlike Western cultures, if we are able to limit mortality, means deaths in families, everything else will come. And that I tell from the experiences I have in working in the disasters for the last 20 years. That if we are able to limit mortality, we are able to overcome all other things. We are resilient, we cope all other things. But if mortality happens and if morbidity increases, then what happens is that's where it breaks our back. And last year, what happened? That initially there were these stigmatizing deaths that did create mental health issues, particularly in the families which had to face those stigmatizing deaths. Then there were isolated, clusters of some cases because there was this quarantine which was still a little bit forced on young people. And then there were hardcore COVID-related mental health issues. For example, we were one of the first who reported about post-COVID deliriums. We reported about first 49 cases which we saw, which actually means the memory and cognitive issues occurring in elderly people, generally in elderly people after they recover from the COVID. We had those issues. Then we had certain young men who had what we call as autonomic issues, in the sense that their hearts will palpitate a little bit more, they're sweating post-COVID. And then we had people who already were predisposed to develop, as you rightly said in intro, illnesses like obsessive compulsive. They might have had already milder one, but once the COVID pandemic, their illnesses became a little bit more severe than that. They started becoming more moderate or severe. And then there were already diagnosed patients who, because of the kind of stresses which got generated, they relapsed and recurred. And that was the limited mortality we had. And I'm telling you this, in spite of the fact that, my hospital, when almost whole Kashmir was locked, all hospitals couldn't see OPD, outpatient departments, we saw around 77,000 patients in outpatient from March the 21st to 31st December. And then we had around 40,000 teleconsultations by the whole department, and lots of it were done by myself. And from that whole data, I'm trying to tell you that what we saw, and it extrapolates to the whole culture because the numbers are so high that epidemiology could be really extrapolated to the whole culture. And that's why I had lots of optimism last year about the mental health. So I would speak about that. I said that whatever will be happen in the West, but probably we have escaped the huge mental health epidemic.
So,
We have issues as I said, but we probably have. But I could no longer actually, that optimism could no longer be said about the second wave as well. As soon as the second wave started coming, one that it struck us suddenly, it got lots of people into hospitals. The mortality increased very, very suddenly. Unlike last time when there was a plateaued peak, this time there was a very sudden spurge and peak. So lots of people had to struggle within the hospitals. And this time we did see mental health determinants directly coming. Within first 3-4 days, we saw people coming with 4 or 5 patients almost every day coming, which had COVID-related mental health issues. And it continued for long. Lots of young men, particularly, who struggled with their parents or with their relatives in the hospitals, but ultimately those couldn't survive. They were deceased, and then they had to face that grief period also alone. There was not that kind of sympathy, empathy, which is very, very integral to our culture occurring during that time. They had to fight that grief period also alone, and that actually resulted into breaking of their mental health. And I did see lots of them coming to us with depressive illnesses.
So I'll just start with the beginning of what you said, and then once you answer that, I'll move on to other questions from some very important points that you made. The first is that you said that it is in fact fear that drives us, that develops in us the drive for survival. So the what is generally considered is that because Kashmir and Kashmiris live in extraordinary circumstances, and because of the situation here, we might be more predisposed to or more vulnerable to mental health issues. And that could have made us more vulnerable once the pandemic hit us, right? So is it so? I mean, did the fact that we were already the situation here was such that we were already more vulnerable have any further impact on either our survival drive now, as you said it, that because we already had seen something like that, or did it make us more vulnerable?
No, we're talking about COVID. I'll tell you that probably, not trying to minimize the mental health impacts which had been here. Not trying to minimize that. But in spite of that, if you go by any studies which have been done, the scientific studies, there have been always more people coping and resilient here. I think the Kashmir story is about coping and resilience always. And I always believe that whatever will be at the surface, you might, people tell you that everybody is depressed here, that's not the truth. That's not the truth. The truth is that most of the people in Kashmir, in spite of whatever we have faced and whatever is actually going on currently in the pandemic as well, have been coping and resilient in terms of mental health. And that is something which is, and there are factors to that. I always say that we have coping mechanisms of the types and kinds which make us to actually cope in such situations. We have social networking, we have social bonding, we have altruism, we have humor, and we have, above all, the kind of belief systems which we have, make us to cope and be resilient in terms of fears, disasters, traumas. And that is essence of our culture. Yes, from time to time onwards, some of us do succumb to the vagaries and black holes of trauma, but most of us do cope and are resilient in face of traumas.
But there has still been seen a trend among young people, especially, who are facing the sense of alienation more and more. What could explain that?
See, young people world over have issues. I understand, unlike the new generation, there are lots of issues which probably make them a little bit more vulnerable to mental health issues than probably was my generation or the generation before. And certain factors which we try to see. One among them is that the kinds of stresses and strains they face in day-to-day life are much more than usually the young people used to face. The youngness usually used to be associated with happiness, elation. You will be, young was that, young, even if you currently say young actually does not mean only did not have age. It had an essence of being free. So that thing actually has gone. People have started. This modern world's, particularly modern urban world's demands on young people are very, very high. The issues you are alluding to are absolutely pertinent to mention. If we do not talk about that, the substance abuse, because
so
that
substance
is
abuse
something
is related to mental health issues, and how much of it is related to mental health issues?
hugely, particularly to the severe mental illnesses. I tell you that once we admit patients currently, out of 10, if I admitted 10 in a day, which means usually severe mental illness, and I'm actually talking about a young man, 9 of them are related to substance use. Severe mental illnesses are hugely related to the substance use currently in Kashmir. I'm actually not talking about illness like depression, which might have the factors which we described. I'm talking about psychosis, mania. We generally see substance use related to that. And substance use is really taking toll of both healths, the physical health of young people and the mental health of young people. Physical health in the sense that it now, this is no hidden thing in Kashmir. At one point of time, we used to whisper about it. I have talked about it in 2006, that substance use has started killing young men. So that was a whisper. I probably wrote it in some greater, some local daily. But now that's no longer a whisper. All of us know that young men are dying because of substance use. And substance use is killing young men. We have to accept that new normality in us. Besides that, I tell you that only last week, we probably had 15 people, 15 admissions of substance use, which we had in our substance use ward. Out of them, probably 12 had comorbid hepatitis C. It's driving other illnesses as well, hepatitis C, hepatitis B. We till now were aloof to HIV. In spite of HIV looming on, we were aloof to it. Do not be surprised even if our HIV cases also start increasing. Don't be surprised because of needle sharing and other things. Other illnesses have started. I see so many of them. I said that it's so alarming. We will see in 1 month, last year only, in 1 month, we might see 1 or 2 of them actually having hepatitis C comorbid. And this year, last month, I tell you that out of 15, 12 of them had hepatitis C. It's huge actually. So, and when I say hepatitis C, it doesn't now have effect on his health only. It has effect on the society's health. It has effect on the family's health, because hepatitis C a chance of spreading from one person to other person. And that is what substance use is doing. So it's killing both the physical and the mental health of the youth. Once people stayed together, there were issues which started arising. Probably there are certain studies of domestic violence. There are certain studies of other kinds of things which started happening in the family.
Anger issues have also risen, and that has severely impacted parenting.
The issues which, because of everybody's busyness, where under carpet started, surfacing. So that did happen. But I will still think that there were lots of people who got lots and lots of time with their families. And regarding kids, you have put in a very pertinent question. It was very difficult times for kids, much more than this. In spite of whatever people will tell you, there is this huge lobby of people who think that, who do not understand pandemic situation, and as soon as they see a paper coming, Google it, and they start talking about it without actually realizing it, without actually being on ground and doing something. And some of them, who talked about these classes, these these online classes. The best thing which happened to the kids, and I'm talking in terms of mental health, was online classes. If it was not for the online classes, they would have been bored to depressions. It was because of these online classes, the children's activities could be structured.
Now I'll just move to the concluding remarks, and my final question to you is going to be: have we finally tuned up to this new reality? Are we not as vulnerable as before, or is the looming stress and the looming threat around us still going to stay, and we're not yet out of it really?
See, they're both yes and no to this answer. Yes, in the sense that all of us have started actually learning to a bit to live with this. But then, acute stresses, sometimes you might be able to live even with severe acute stresses, but the chronic stresses might actually bring in lots of other factors as well. So we might be able to actually fight it for some more time, but then ultimately all of us loathe for that normality, when it will return, when will actually we all of us loathe for that. So that is something, and that is the hope as well. In my remarks, concluding remarks, in fact, I should say that this is the dark tunnel we are in, but at the end of this tunnel, there definitely is a light. If you look at the history, that gives us the optimism. Human beings have conquered even more severe of the pandemics and stress and disaster. This is very small in terms of that. So, and in this disaster, but normal times are going to be happy for all of us, and with less mental health problems if we limit mortality and morbidity because of COVID. If we try to adhere to COVID protocols as much as possible, if we are not extravagant at this point of time, if we accept these periods as periods of survival, if we accept these periods as periods of survival and do all things which are essential and not do anything extravagant, tomorrow is the happiness, and the happiness is there. But if we do not do that, the mortality morbidity increases further, if it affects us that way more, then we might be out of this tunnel, but we might not be happy.